Welcome back. With us right now from the Neurosurgical Spine Program at Hoag, we have Dr. Burak Ozgur, and I'd like to welcome you here, sir. You are neurosurgeon and you are also the chief of service.
Yes.
Right?
Thank you for having me.
Yeah, it's great to have you here. I think it's a really good topic, and the reason is obviously your spine is your nervous system. It's your highway to everything else in your body. But when you got a problem with it, particularly some sort of pain with it, it can really be debilitating to people, can it?
Sure, it can, definitely.
So overall, kind of what is your approach to spine care? Is it, over the years we've seen all different types of things, from surgery to something that's more non-invasive. So do you look at different problems and kind of go from there?
Yeah, actually when we talk about spine, it involves your entire backbone, literally from the base of your skull down to your tailbone. So what's most common is lumbar spine problems, which is the lower back, but also commonly our cervical spine or neck problems. And these can manifest with different things. Numbness and tingling in your hands, numbness and tingling or pain down your legs, commonly called sciatica, or typical back pain, lower back pain, neck pain. So those are all spine problems that we deal with. And my approach is really, number one, conservative. Can we avoid surgery? Can we treat patients with prevention, good health, exercise, core strengthening, weight loss? That's number one for anybody. If that fails, then sometimes we go on to injections, epidural shots, things like that. And lastly is surgery. If everything else fails and the patient continues to suffer, then we may consider surgery. But the good news is we have great minimally invasive techniques these days, which means smaller incisions, quicker recovery, fewer complications. And this is for all age groups, can benefit from the minimally invasive techniques.
Well, I know how debilitating it can be. I've had friends with that. I have a neighbor right now who's taking epidurals and all, and sometimes it works. It's more of a short-term fix, and I think he's maybe have to look at the surgical route sooner or later. But you mentioned something that people might not be aware of, that it's your spine. When you have tingling, maybe in your arms or legs, but you may not have pain in your spine. Is that what you're saying? Down your back, you may feel it somewhere else.
Yeah, in fact, commonly patients have a herniated disc or pinching of the nerve from other areas. And so they may have no back pain at all. It may be just completely down their leg, or they have weakness in their legs, or a foot drop, which is when your foot drops down and you can't pick it up.
Interesting. Now, some of the latest treatments is there an approach to, can you rebuild a disc or regenerate it, or does it have to be surgical? Is there medications for that? Because often that's what you hear is the problem.
Right. There are many medications to reduce swelling. So an epidural, for example, has steroid within it, which reduces swelling. Now, steroids may not be good for long-term treatment, but short little bursts once in a while are generally okay. And that can help bring down inflammation. As far as rebuilding the disc, there are newer technologies that are coming out, stem cell therapies, to try to regenerate the disc. It's kind of early on right now, and hasn't been as consistent as we would like, so we're waiting for more and more data. But there are some stem cell treatments that are being done to try to help the joints of the neck, of the lower back. Some people have injections of various types into their shoulders, their hips, and their knees in the world of regenerative medicine, which includes stem cell. Those are all potential options for some people. It doesn't work for everybody, and again, it's relatively new, so we're learning more every day.
So overall, what are some of the causes for this? Could it be that somebody's just been very athletic over their life, and they've had, from that alone, maybe playing a contact sport? Is it, as we just age, it becomes more common? Is it weight? Are there all these different things or factors?
Unfortunately, it's all of the above. So for some people, it's genetic, and they do all the right things. They're in great shape, but still they have a bad spine. Other people have a great spine and may be way overweight and out of shape. For most of us, we're somewhere in between. And the most common thing that we could chat a little bit about is spinal stenosis.
Okay.
That's extremely common. That means when the spinal canal is literally pinching the spinal canal, the cord or the nerves. And most patients will have some symptoms down their thighs or their legs when they try to walk. So characteristic is a patient feels okay when they're sitting or they're laying down, but when they go to stand up, they can't quite stand up completely straight up, and they in fact lean forward when they try to walk. They can't walk very far. They take frequent pit stops where they sit for a few minutes and get up and move. But as this chronically gets worse slowly over time, they walk leaning forward more and more, and their family keeps telling them, stand up straight, stand up straight. So that's very common. Again, we would start with conservative options first, but if that fails, then there's a minimally invasive technique through a microscope where we can shave down some of the bone and make the tunnel bigger. And it literally changes someone's life where they can now stand up straight and may be able to live independently. We've had a lot of patients who feel that they're 20 years younger now that they could stand and walk a little bit longer.
That's amazing.
Yeah.
Now, of course, we have to look at the prevention side.
Yes.
So are there certain things people can do? Yes, you know, if it's hereditary, or perhaps, as I said, maybe they played certain sports. Obviously, golfers, you hear about this all the time. But in general, can people do things to strengthen their spine, safely strengthen it, and just some kind of an exercise or something they can do on a routine basis?
Definitely. There's a lot we can do. All of us, including myself, can use to lose a few pounds.
Yeah.
So we can all lose some weight, get in better shape, and build our core. That's something that's beneficial to everybody. And I'm not talking about going to the gym and lifting heavy weights and doing heavy squats. That, in fact, a lot of times hurts our backs.
Okay.
But I think there are healthier ways, such as right before our discussion this morning, I know on the channel they were showing some exercise techniques. Those are great things to do to help increase our flexibility, teach us safer ways to move, to get in and out of bed, in and out of a car, ways that we could minimize our damage to our spines, and little things can make a big difference. So prevention is the most important thing.
Okay. As far as the spine program at Hoag, what is the overall approach to it? Is one of, obviously prevention would be the best route to start, but it's very comprehensive and all the different things that you offer. But you know, what I like the best is that you start out with things that non-surgical options first, instead of somebody just going, oh yeah, you're going to need this. Right,
right. Well, what we set up at Hoag is a triage system, which basically means that if you go in through our website or you call, you actually talk with a nurse navigator first.
Okay.
And she's wonderful. We've set up a system where you can talk to her about any symptoms that you have, and she will help try to figure out what you need. You may need a primary care doctor before you even deal with your spine.
That's true.
Your diabetes may be out of whack, or your hypertension. Those are things that need to be dealt with first. So if somebody needs a primary care doctor, if they already have one and now they're having spine issues, do they need some physical therapy? So can we arrange PT somewhere close to the patient? Do they need a pain doctor? Do they need PM&R, physical medicine and rehabilitation? So we want to exhaust all these other options first. Although I'm a spine surgeon and head of the spine program, I'm happy to say the majority of patients do not need surgery. Don't be afraid to call, because we're not going to try to push you into surgery. In fact, we want to push you away from surgery.
Okay.
Try these other things, because most of the time these other things work. If they don't work, then you end up seeing me or one of my colleagues, and we talk about options.
And what point in time should somebody be concerned? We all might have a little numbness or something because of something we've done that day. Maybe you worked out in the yard or something like that. Is it, if it doesn't go away in about a week, or?
Yeah, that's a great question, because we all hurt our backs all the time, and that's one of the most common things. We did something a little bit more than we normally do. We didn't properly prepare for an activity with our kids, our family, our friends, and so a lot of times our back aches. We can take over-the-counter ibuprofen like Motrin or Advil, some ice, some rest, and thankfully most of the time it goes away. But I think you're right. About a week, if it still lingers and it's affecting your ability to work, to play, to get out, and you're just laying in bed and it's really
Yeah.
agonizing, then you may want to talk to your doctor. Also, if it's going down your arm or if it's going down your leg, you're developing a weakness, a numbness or tingling that's just not going away. Those are some warning signs that you may need some help.
Okay, very good. Pleasure to meet you, sir. And the website is hoag.org/neurosciences. The phone number is 949-764-6066, and that's for the Neurosurgical Spine Program with Hoag. And I want to thank you for coming on. Great information.
Thank you.
I
Thanks for
appreciate
having
it.
me.
Prevention, right?
Yes.
All right. Yeah, he's a nice guy, but you'd rather not see him.
That's right.
Right? Okay. We'll be right back.